Morning. My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition and exercise. How to live a longer, happier, healthier life is my mantra. My website is drdrmedicalhypnosis.com for your own personal hypnosis videos. Today I'm going to discuss 6 severe symptoms that if you develop them, you must take emergency treatment and get 911 and get to the emergency room. Oftentimes these signs and symptoms develop and patients ignore them and attribute it to something else that it really is. We will start off at the head and work down. Now, all of us get headaches. The vast majority of these headaches are not serious, whether it's a migraine headache, a muscle tension headache, headache from alcohol abuse or dehydration, or headache that comes with fever. Those are not serious. But if you develop an acute, severe, intense headache, like a clapping in your head, sudden in onset, you must summon 911 immediately, because this could be either a stroke or it could be a ruptured aneurysm. These are serious and need emergency care. So a headache that is different from anything you've ever had, rather call 911, go to the emergency room, and even if it's nothing, let them tell you it's nothing. But you do not want to delay and make the diagnosis yourself. That is for a stroke, or also commonly known as a brain attack, or a ruptured aneurysm. That's a ruptured small balloon in an artery which ruptures, causing blood in the brain. The next is acute, sudden onset of severe left-sided chest pain. The pain radiates down the left arm up into the neck, is accompanied with sweating and a feeling of coldness, nausea and or vomiting. This is the beginning of a heart attack and needs to be taken, you need to be taken to the emergency room immediately. Medical science has found that if at the onset of a heart attack, if you can get to the emergency room within 3 hours, either with a heart attack or a stroke, if you can get there within 3 hours, there is still time to use this specialized blood clot busting medication, which dissolves the clot before the crucial time of 3 hours. And oftentimes a stroke that could have been major is now relatively minor, because the blood clotting busting medication was used. So that's a heart attack. The next thing, still remaining in the chest, if you have been on a long trip, or you tend to get swelling of the legs, or one leg, it usually means a deep vein thrombosis. In and of itself, it's not too dangerous, but you have to get blood thinning agents, because if a piece breaks off and lands in your lungs, then you develop a pulmonary embolism. And this is characterized by severe chest pain and coughing of blood, and you feel very ill with it. Do not hesitate. Do not make the diagnosis yourself, oh, it might be a pneumonia or bronchitis. If you've been traveling and you have a swelling at the back of your leg and suddenly you have onset of severe pain in your chest, you must go immediately, because the clot, if it continues to grow and grow, it could be lethal. The next thing is blood in the urine, painless blood in the urine. If you get blood in the urine with pain, that could be, especially if it's one-sided, it could be a kidney stone or a severe prostatitis. But if you get painless blood in the urine, do not try and make the diagnosis yourself, because this could be a cancer of the kidney. cancer of the ureter, and cancer of the bladder. So and that goes for any other place in your body. If you notice blood, don't ignore it. Go to your doctor, but if it's sudden in onset and it's painful, get 911 immediately. Or at least call your doctor's office and find out what she or he would like to do with you. The final one is acute asthma that does not respond to your normal medication. Let's assume you suffer from asthma and you take the inhalers, and normally it breaks the attack. But if you should have an acute asthmatic attack that is not broken by your normal medications, this could be a life-threatening situation, and you don't want to land yourself up in lung failure or pulmonary failure. Go immediately, summons 911, and let them take you to the emergency room where, again, you can get urgent treatment that could prevent anything serious. So in summary, folks, what I suggest you do, if there is something really abnormal that you don't have, and it's accompanied with severe symptoms of either pain or bleeding or hemorrhage or whatever, please do not make the diagnosis yourself and put it off. Rather call 911 unnecessarily. Rather go to the emergency room unnecessarily and let them tell you it's nothing to worry about. I have seen so many cases with strokes and heart attacks where the patients have diagnosed their condition themselves and they've landed up near moribund, severe complications because they didn't go in time. So these are the 6 severe symptoms: the severe headache, the heart attack, pulmonary embolism, severe asthma that doesn't respond, and the 5th one is the bleeding. The 6th one is depression, because depression can land up in death. People who are depressed can commit suicide. And if they threaten suicide or they have suicide ideation, that suicide thoughts, don't take it lightly, because sometimes they complete their thoughts and unfortunately they die either by they die by their own hand, either with a gunshot wound or with drowning or with hanging, shooting, whatever it is. Depression with suicide is something not to be taken lightly and needs to be taken care of immediately, because unfortunately sometimes you have severe deleterious problems leading to death. So just in summary, it's the severe headache that you don't usually have. Secondly is the acute left-sided chest pain radiating down the arm, meaning a heart attack. Third is the brain attack, where you can have a stroke, and that's characterized by the severe pain in one side of the head, and it is associated usually with numbness or tingling in any part of the body, the face or the arm or the leg. That is a stroke and needs to be treated properly. The sooner you get to the emergency room, the better it is, because, as I said, there are these clot-busting drugs that can be used. Pulmonary embolism with a deep vein thrombosis in your leg, very serious, can lead to death. Go immediately. And then there's the bleeding from the kidneys, and then there's depression. These signs and symptoms, folks, I want you to take seriously, and please send this out to your friends and family that they should be aware. There is nothing here, what I've said today, that will respond to hypnosis or anything like that. So please send this out to all your friends, and this is as a public service message, shall we say. My name is Dr. Hillel Mazansky, and I thank you for listening to my health tip.